Today, we are extremely privileged and very, very delighted to have with us Dr. Roop Siddhana, a very senior psychiatrist and addiction specialist with over 4 decades of clinical experience in the field of mental health and de addiction. Dr. Siddhana is the consultant psychiatrist and clinical director at TCSM Psychiatric Hospital and De-Addiction Center in Rajasthan, where he has been actively involved in the treatment and rehabilitation of individuals with substance use disorders and complex psychological conditions. He is widely respected for his work with adolescents and young adults, particularly in addressing the growing challenges of addiction, emotional distress, and behavioral problems among youth. Dr. Siddhana is also a regular speaker at professional forums and public awareness platforms, known for his balanced, compassionate, and evidence based approach to mental health. Thank you so much, sir, for giving us your valuable time. Without any further delay, now I'll come straight to my first question to you. Sir, you have worked a lot in the field of substance abuse. Now, please tell us what are the different types of substance abuse and which is the most harmful category of substance abuse, and what are the effect of substance abuse in the body and mind of the abuser?
Ms. Arpita Sarkar, for doing this podcast, and I hope the podcast will
Yes.
help many people in
Yeah.
not just knowing but changing their lives. And I've been working in the field of substance
Absolutely.
abuse and mental health for last more than 4 decades. And the place where I work is located close to the Pakistan border, in Punjab and Haryana border in Rajasthan. And I have come across a lot of people with substance abuse.
Yeah.
And the type of substance is the most common substance which is abused but not counted as addiction is tobacco, nicotine in various forms, smoking, chewing, and sniffing. And it is the most common substance, and I say that it is the first step to any other addiction. In yes, people start with initially tobacco,
Okay.
nicotine in any form, and then they move to other steps. But nobody considers it as addiction commonly.
Okay. Yeah, and there is no social
Next,
stigma
we come
also
to
attached
alcohol,
to
which
tobacco or
is
cigarette
a
addiction.
substance which is most commonly used and abused as a substance of addiction, and it is used in various forms. Everybody knows, from beer, whiskey, wine, and breezer. Many of people think that beer is not alcohol at all. They think beer is just a usual beverage which can be used by everybody, but it contains alcohol about 8 to 10%, and it can be as harmful as any other form of alcohol. Then we come to opiates. For a long time, opium was being used as one of the substance, and then came the opium husk, which is a crude form of opium, which contains about 10% of what the pure opium the morphine is about 10% in it. And this was at one time a legal substance available on government approved shops, but on permit in Rajasthan and in Madhya Pradesh. But later on, it was banned in about 2000, around 2005 or 6. And now it is an illegal substance which is still used by many people, especially the rural folks. And
But sir, morphine is a medicine also, na? As painkiller it is used, right?
Synthetic opiates.
Okay.
Which are morphine, then the pure form synthetic is smack or brown sugar. Then it is the heroin, which is commonly in colloquial terms, it is called chitta, white substance, because it's like a white sugar, and this is used in the form of sniffing on a silver foil, or it is used as injection, intravenous injection by many people. And it is one of the most dangerous kind of substance which is used by addicts. And then there are other synthetic opiates like tramadol or pentazocine or fortune, which was commonly used orally as well as in injectable form. And then came tramadol, which is again a synthetic opium group derivative. It was available earlier in the form of oral and injectable. And since it was banned, the next came the drug from the opiate group was tapentadol, which is still being used by physicians and psychiatrists to detoxify people who are on either heroin or other opiate, hardcore opiate. Then codeine is another drug which is available as one of the opiates, which is used in the form of tablets or in the form of cough syrup. Corex, most commonly available substance in the form of cough syrup, which contains codeine. People mix other drugs, and it is an addictive substance. Apart from opiates, then we have cannabis. Cannabis is a naturally occurring herb, and it contains intoxicants, cannabinoids, or tetrahydrocannabinol, THC. The marijuana
Is this marijuana? This cannabis or marijuana?
Naturally occurring plant.
Okay.
The flower seeds are crushed and they are used in the form of leaves, flowers, and seeds are used in the form of either smoke or mixed in beverage like milk products, or in the form of pakoras they use. And then there is another common substance on the form of cannabis, which is available as pills, small pills, as an Ayurvedic medicine, which is called munakka, or it is also called lahri. These are the products which are available in the market. This is the cheapest form of intoxicant which people use in this part of the country, especially.
These are legal, sir, available in the market. You said legally available?
Ayurvedic medicine. And it is not counted in the narcotic substances, and it is not, the punishment is not as harsh as with any of the narcotic drugs. Cannabis is smoked in the form of cigarette, in the form of chillum, and cigar pipes, and it is used in religious functions commonly in northern India, especially Rajasthan, Punjab, Haryana, and in UP, especially during pakoda or thandai.
Pakora.
Milk product.
Pakora.
This is used at the time of Shivratri, most common. It is used as prasad. offering, and many people drink it, and they most of the times in our clinic, every Shivratri and every Holi, we get one or two patients with cannabis-induced psychosis because patients react adversely and they have psychotic disturbances. Next, the group of substances we have is inhalants, inhalants, which is common in younger generation. And inhalants, you will be surprised that the liquid which is used to erase ink and typing thinner is being used by students. Sit on the paper napkin and sniff it. And then some people even inhale petrol and diesel or paint.
But
Gives them a kick.
does that
It
give
gives
any
them a
kick?
kick.
Like, why do they do
Alters the
that? What
sensorium
fun they
and
get?
it alters the pleasure
Okay.
sensation. Many people use that. Yeah. So if you
Okay.
addiction is such a field that you
Right.
stop people from one thing and it goes on to the other thing. But then there are people who
Yes.
promote. We say that addiction is an industry. Addictive to produce addictive substance is an industry which goes beyond the legal system. The government bans one substance. At the same time, in the laboratory where these addictive substances are produced, an altered variation is available. As soon as it is banned, an altered substance is available which can cause addiction, which people start using it and they start promoting it.
Right.
So these are the kind of addictions, and out of this, I would say the most common nicotine is harmful because it is being used for years together without any stigma, without any knowledge of harm. So the cancer is most common with the nicotine abuse, either throat or lungs. And the respiratory diseases are also common after smoking. But the most harmful physically, socially, and economically is heroin. 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 It's the opium derivative,
Heroin.
synthetic opium
Okay.
derivative,
Okay.
and it takes only a few days to get addicted to heroin. It is very expensive, and the crime rate in heroin addicts is much higher than any other addiction because to obtain and to smuggle these substances, it's a big criminal activity. And then
Okay.
it comes
And
from
these
in India, it
things
comes from
come from
Pakistan and
Pakistan border in
border.
India, in Rajasthan.
Pakistan, Afghanistan, and China. So that's why it is most common in northeast states, and it is common in Punjab. And in Rajasthan, from across the border from Jaisalmer to Ganganagar, it is smuggled from these.
Oh.
So, and heroin, if it is injected, can lead to diseases like hepatitis C, which is very rampant in our area where I'm practicing. Every second patient who is on heroin comes hepatitis C positive. That's a liver damage producing viral infection. Then HIV. That is also very common in people who use injectable heroin. These days, even drugs like tramadol and tapentadol are being used by people who are addicted to other drugs, when they don't get anything else, they take a tablet of tapentadol or tramadol, crush it, and inject by themselves. So these can be very dangerous, life threatening if taken in overdose. Because these people who are using it, sometimes they are not aware of the potency of the synthetic molecule that they get. If it is, they can inject heavy amount and they can it can lead to sudden death immediately. So overdose are common in people who are using heroin.
Correct. Okay.
Yes.
And sir, what is the difference between abuse and addiction?
Abuse is use of any prescription or off prescription substance which affects the activity of the brain without any indication and without knowing that it can harm, or even when you know that it can harm, you are still using the molecule over a period of time. And addiction is when you get used to this molecule. It can be alcohol, it can be nicotine, it can be heroin, it can be cannabis. And addiction, when we label, it has two components. One is tolerance, other one is dependence. Tolerance means for the same effect, you need higher dose of the molecule. Like somebody who is using 1 gram of heroin, now he doesn't get the same after that. He starts using 2 grams. Similarly, somebody who is taking 2 pegs of whiskey, he doesn't get the same kick out of the 2 pegs. He needs 3 or 4 pegs to get the same amount of pleasure or kick. So, tolerance, that you need higher dose. The body is getting used to it. Dependence is at this time when your dose is due. Like somebody who's taking alcohol, when he becomes addicted, at the time he gets a craving to so much extent that he starts getting physical symptoms of withdrawal, which we call withdrawal symptoms. So second stage, from tolerance, then dependence. So these are the two criteria which we need to call it addiction. There is body to the body, still person is not able to leave because of the physical withdrawal symptoms, then it becomes addiction.
राइट ऐसे फिजिकल विड्रॉल सिम्टम्स क्या होता है सर मतलब जैसे कि एग्जांपल
For alcohol, the withdrawal symptoms usually starts within 12 hours to 18 hours. And they manifest in the form of anxiety, tremors, and nausea. And if they are more, it can lead to psychological symptoms in the form of fearfulness, and sometimes it can lead to a serious condition which we call delirium tremens, where the person gets confused, he's not able to take care of himself, and it can be life threatening. Similarly, for opium,
okay
yes,
he can be aggressive
his
also
craving
to
may
the
be
family
more,
members
and he's not able to control.
Okay.
And if somebody is refusing to get him the drug, he might be aggressive towards them. And in delirium tremens, they can be harmful. They can harm themselves or to others. Then is like if you are talking about withdrawal symptoms with the opium, most common symptom, once the patient is not given the dose at the right time, after 12 hours, it can go up to 7 days, the withdrawal symptoms of opium, depending upon and what kind of substance the person was taking. And it starts with body aches, pain in the legs, pain in the joints, and
Okay.
sneezing, watering from eyes, and jerks in the body. And if it is more, then there is restlessness, confusion, irritability, and insomnia, and it can lead to a lot of other complications. Withdrawal depends upon how much he was consuming and for how long he has been consuming that.
Hmm.
And if the person is taking multiple drugs,
Hmm.
then the withdrawal
Okay.
is even much more
Huh.
complicated and
Hmm.
it's difficult to manage. So when you say that abuse is addiction, abuse
Okay.
is
Okay.
just
Right. Acha sir, in
adat,
our, huh.
just test. But addiction is lat,
Hmm.
which is much more severe physically, psychologically, and socially.
Yes, yes. And sir, in our mythological stories, we see that King Indra in his sabha, he used to drink somras, that is alcohol and wine. And then our Lord Shiva, he is believed to consume opioids. And as you said, na, in Rajasthan, like in Rajput marriages, opioids are served as welcome drink and all. So does it indicate that it has some therapeutic use
See,
also, or it
culturally,
is
these
just
things are
for fun?
used, but they were used in moderation. But it gives a social sanction
Hmm.
to youngsters who don't know the uh,
Right.
negative effects of these things when they are used in excess quantity. So, like in Punjab, every
Hmm.
marriage
Hmm. Hmm.
function needs to have a bar and they have to serve openly liquor. So, liquor
Ah.
gets sanction. On the other hand, in Punjab, Sikh
Hmm.
religion prohibits use of nicotine smoking. So you find that in youth, smoking starts much later and is less common in people who follow Sikh religion. But alcohol becomes much more prevalent because it
Hmm.
initially has a social sanction. And they say out of the people who
Okay.
start taking any
Hmm. Hmm. Hmm.
substance like alcohol or opium, 1 out of 4 or 1 out of 8 are
Hmm.
going to become addict. They are going to become dependent on these substances. So those who start, everybody is not going to become addict,
Hmm.
but 1 out of 4.
Right.
That will depend on the personality of the person, the circumstances, the environment, and the stress and the availability of the product.
Hmm.
Yes.
Right. Right, sir. Okay. But sir, tell me, how does this habit of substance abuse start? Does the socio-economic status of the abuser
Yes.
have any role to
When
play
we talk
here?
about substance abuse, we say there are three things: the substance, person, the environment. The
Hmm.
interaction of all three come into play. In when we say the common causes of
Okay.
starting addiction, one is peer pressure. In youth, this is the most common that you have friends. Out of the friends are drinking, the others are not. And to
Hmm.
give them company, they will pressurize. You are my best friend, you are my brother, you must give us company. There's nothing wrong is going to happen
Hmm.
with you. With
Hmm.
come, let's
Yes.
have.
Yes. हाँ, एक बार लेके देखो, एक बार तो
मेरी कसम
लेके
है,
देखो
एक
ना.
बार लेके
हाँ,
देखो,
what a spoiled sport you
कुछ
are.
होगा।
Yes.
मैं हूं ना तुम्हारे साथ. Then there is
हाँ.
a media
Hmm.
pressure, social media, Bollywood movies, Hollywood movies. You see the hero, the villain They are having drinks, they are having smoking, and the the youth tries to copy them. They start smoking and they make a pose as if
Yes.
it is like Devanand or it is like some any other hero, and they feel that on top of the world. Then is the stress factors,
Yes.
loneliness, stress due to any effect,
Hmm.
failure in exams, failure in love, failure
Hmm.
in your financial area, breakup. All these things can lead to stress and a
Hmm.
beginning of the addiction, because many of these
Hmm.
substances which cause addiction or dependence give pleasure, reduce stress for the time being. Then the brain gets rewired into using
Hmm.
these
Hmm. Hmm.
substances to get pleasure. There is a dopamine system in the brain which gets activated with
Hmm.
any of these pleasure inducing
Hmm.
substances. And then the body craves for it. The person may not
Right.
agree, but still the body demands
Hmm. Hmm.
because it has been rewired. The neuronal system has set into a new balance. So, and then I said the
Hmm.
person, the
Yes.
environment,
Okay.
if you have a company which is giving sanction, which is
Hmm.
pushing you into
Hmm.
addiction, you can go into a substance abuse, substance dependence. If you have a career
Hmm.
where you are struggling and
Hmm.
you are not getting good, that can be a reason. Then socioeconomic status, definitely poor persons have a increased sensitivity to stress, exposure to domestic violence because of the socioeconomic status. But higher socioeconomic status have higher availability of and access to these substances. And because of the higher society level, they may have sanction to use these substances in routine life. So both ways, the lower as well as higher socioeconomic status can have impact on the prevalence of substance abuse.
Right. Right. Okay. Sir, how can the substance abuse like be noticed by the family member in a young adolescent, and what the family member should then take action? First, how can they notice? How can they doubt
Yes,
something
it
is
is.
wrong? And
I
then
would say
what
that
should they
not
do
only
ideally?
parents, but teachers can also be a good guide to notice and prevent, and friends.
Hmm.
So parents can be
Hmm.
sure about their children, whether they are into any of the drugs, by one, their routine, the time they sleep, the time they get up, and their school performance. If there is any drastic change, somebody who was sleeping at 10 o'clock starts sleeping at 2 o'clock and doesn't get up till 12 o'clock,
Hmm.
something
Hmm.
to be warned of.
Hmm.
Somebody who was taking just 100 rupees a week or
Okay.
500 rupees a week and suddenly starts demanding more and more money, or you notice that there are things
Hmm.
missing from the house financially, if he's using more money than what he
Oh,
was using earlier, that can be another. Then his
yes.
school performance or college performance is deteriorating. That is, then he spends more time in the toilet.
Hmm.
Many of the taking opium derivatives have constipation or
Hmm.
use toilet as the means to spend time to take the drug. Yes. And
Yeah, to inhale, to
suddenly you find
inject.
there is a change in his friend circle.
Mm.
Somebody who's studying in 10th class, you see friends are from college. Parents should notice that and should be warned that if this is happening, there is something going to be wrong. And somebody was performing so well in
Yes.
school or college or in sports, suddenly is avoiding studies, not going to tuition, or his performance in sports is deteriorating, then one should be alert and should sit down and talk to the person. Conversation, communication is very important. I usually recommend that those who have children, school going, college going, the family which stays together, eats together, which eats together, stays together. Meal time is very important if
Stays together.
parents
Yes.
spend with the child, and this is the time to open up. You can ask if you are having any problem, if the child is having facing any problem, or he has acquired some knowledge about addiction and he talks to the father about anything, or if there is a news item in the paper or on the TV, and some people are addicted, and he wants to know what is this, Papa. You should be open. And if you don't have the right knowledge, you should, as a parent, you should try to find out what is right, what is wrong. That's, I think, communication, observation,
Right.
and being
Okay.
friendly with the child is key to know the early signs of addiction.
Right. Okay, thank you so much, sir. And sir, now tell us about the different types of treatment methods you follow for your patients
Treatment,
as applicable
I
from
think
case to case.
before treatment, uh, addiction is such a thing, substance use disorders are such that treatment is difficult. And it is time consuming, financially taxing, and it takes a long time. So
Yes.
prevention is
And does the people even know, sir? Sorry to interrupt you, sir. Does the people even know that if there is a substance abuse case, then they need to go
but
to
over
the
the
doctor?
years,
I think many of us do not
government
know only.
and NGOs have been struggling to tell
Huh.
the people that substance abuse is bad for the health,
Huh.
for the society, for the nation. Each year on different days, like 26th June, it is the International Drug Abuse Day, where awareness
Mm.
activities are carried on. And even schools,
Right.
colleges, there are
Yes.
people who are trying to educate them that addiction, say no to drugs today, tomorrow, and every day. And
Right.
even uh, in print media,
Huh.
government as well as the NGOs, time and again bring out rallies, bring out competitions like poster competition or slogan competition to educate people that is bad and prevention is better than cure. And to have somebody who's using substance and is facing problems, you must consult the doctor. Help is available around the corner. Every district has a psychiatrist where free treatment for substance abuse is available. Every tehsil, everywhere there are people who can give you guidance, who can help you if you want to have take treatment.
Okay, that is excellent, sir. We didn't know this when we were in school or colleges, so that is something
When
new
I
for
came
me.
into
So much
this
awareness programs
city
are
at that
carried on.
place, I went to one school to give a talk on drug addiction way back in 1990 or 92. And this principal said that, Dr. Saab, you don't talk about addiction in our school. We have who are using and in drugs. And if you talk about addiction, they will become addicts. They will know about it. Then I said, let me give a talk. And when I talked to the students, I didn't talk about their addiction. I said, if any of your family members is suffering from addiction, because parental addiction definitely is harmful to the children. And many people, many students raised their hands. My father taking alcohol, and for smoking, a lot of people were there. And so when once I talked to them about addiction, it is not that they were harmed. They were made aware that these things are bad. They went home, they talked to their parents, and many of them motivated them to take treatment because treatment is available. So awareness is definitely important, and whatever amount of awareness activities you carry out, it in our country it is going to be less than what is required. Lot of population is unreached where we need to reach. There is a big treatment gap between the people who are suffering and people who are taking treatment. About 80% of the people who need treatment are not coming for treatment, either in mental health issues or in addiction, substance abuse. So you had asked, we have moved from your question. From your question, you asked for
So,
about treatment.
about treatment.
Treatment, first thing is
Treatment.
awareness, that recognition that it is a problem. Alcohol, opium, addiction, nicotine, anything, awareness. Recognition, awareness, and then motivation. That I need to get well, I need to stop it. For that, the family, the teachers, the the health workers, they can motivate them. And then the treatment depends on the type of substance, but it goes through many stages. First is the awareness and motivation, and then detoxification. Detoxification means you remove the substance from the body and make him clean. Since substance abuse or substance use disorder is known to produce withdrawal symptoms, so detoxification is to control the withdrawal symptoms and make him comfortable without the substance that he was using. This may take 3 days to 10 days time. And if it's severe, if there are comorbid
Okay.
mental health issues like psychosis, bipolar disorder, depression, or any other things, then you have to take care of that. And if it is severe, then you need to hospitalize the patient. This hospitalization is for short time. And after and during this time, apart from the detoxification, the treating team counsels the patient, the family, how to take care of him once he goes home. Then next stage is relapse prevention. Once he goes home, it is not that he is going to give up. There are chances that he can have a relapse. So for that, we need to be prepared which takes psychological methods of treatment and physical methods of treatment. There are anti-craving drugs which can help. Then there are deterrent drugs which can help in severe cases. After relapse prevention, if the person has had addiction for a long time, then we need to go for rehabilitation. We need to keep him in a rehabilitation center. If there is a chronic addiction for years together and he has to find a place back to the society, he is taught the skills to get back and find a suitable, respectable place in the society.
Okay. So when during the detoxification process, you stop that drug which you was taking, but to remove the this withdrawal symptoms, you give something else, right? Okay. Mm-hmm. And rehab, in the sense, a person who was like taken away from his livelihood and everything, he was not able to do anything. For those people, they are sent to rehab to learn anything, a skill,
Not only skills
a
to
new
earn,
skill.
but
Okay.
skills to live
Right.
happily.
Okay.
That's all.
Right. Right. So, sir, what is your success rate for curing the addicts? Like, how many out of 100% who come to you for cure,
After
how many actually
detoxification
you
and
can
acute
cure?
phase treatment, around 70% of them get better. But out of this 70%, 50% of
Okay.
them relapse. For relapse prevention, we need regular treatment, which
Mm.
is counseling and drugs.
Mm.
But still, in spite of this, there are many people who are left out, around one third, who don't
Mm.
get back to normal.
Mm.
For these kind of patients, there are harm reduction strategies. Those who relapse again and again, those who are not going to leave, then we use harm reduction methods. Give them a substance which is more safe.
Acha.
If they are having any physical ailments because of the
Okay.
addiction, treat them and educate them to have a safe life.
Mm-hmm. Okay. Sir, I didn't know many of these things, these tapes and all, and I'm sure I hope people watch this podcast. This is so educative. And sir, prevention is better than cure, right? So, what are the steps being taken in India, all over the country, for prevention of drug abuse and addiction, and how renowned psychiatrists like you are associated with these preventive initiative measures?
When prevention is better than cure, it is very true for substance abuse disorders. And we divide prevention into three levels of prevention: primary prevention, secondary prevention, and tertiary level of prevention. My primary prevention is either reduce the
Okay.
availability or reduce the need, cut off the need and reduce the availability. Reducing the availability of the substance is at the level of the government.
Ah.
Strict control over manufacturing, transport, and there are laws and there are methods by which government is taking care of them. Reducing the use of initiation of the substance, that is by education, where government along with the health, education and the social welfare department, they all work together. Not only government, even non-government organizations, voluntary organizations. They work together from schools, colleges, and in the society to see that people don't start using drugs, don't start using any substances. For that, you need to change the society. You need to educate the youth that drugs are harmful and you need to stay away from them. You need to say no to the drugs for the first time. Second is the secondary level of prevention, where we need the early diagnosis, recognize early, accept the child has a problem, and approach the right person for treatment. Many of the people have
Right.
stigma. Oh, if I tell anybody, I will be insulted, I will be looked down upon by the society that my child is addict. So they keep on prolonging the to start treatment.
Yes.
So early diagnosis,
They
सुधर
expect
जाएगा,
a miracle
या
will
अपने
come
आप ठीक
from
हो
God. The child will
ठीक हो
be
जाएगा.
cured
With age,
on its own.
responsibility.
सुधर
Many of the
जाएगा.
times we have seen that they even marry their children. कि भाई इसकी शादी कर शादी के बाद जिम्मेवारी आ जाएगी, रिस्पॉन्सिबिलिटी आएगी
कि शादी के बाद ठीक हो जाएगा.
that
हाँ, जिम्मेदारी आ जाएगी,
so
ठीक हो जाएगा.
early diagnosis and
Blunder.
proper treatment is the secondary level of prevention, and third level is rehabilitation and taking them back into the society. So all
Okay.
parents,
Sir,
youth,
yes.
and the police, the government, the health department, the social welfare department, everybody works together for prevention. And there was a study that one of the countries, they said that during assembly and prayer, there was one sentence every day used to be spoken that मैं नशा नहीं करूंगा और जो
पाकिस्तान.
नशा करेगा उसका मैं इलाज करवाने में मदद करूंगा. I will not take any addictive substance, and if there is an, I will take them for treatment. And in India, our government has come up with the Nasha Mukti Abhiyan from top to bottom, and from center to each state they have the campaigns to prevent and treat substance abuse disorders. And even the most neglected substance, I said tobacco or nicotine, the government of India has come up in one day. Modi ji inaugurated thousands of the tobacco cessation clinics in the country. Each medical college was asked to start a tobacco cessation clinic. Yes. So it's not only makes the treatment available, but also motivates people to campaign against nicotine and tobacco products.
Excellent. So, sir, you are satisfied the amount of efforts our government is taking for
No
substance
way to get
abuse.
satisfied because population is so big, and the more we are approaching, there are more newer molecules are coming. So it's a race which we have to keep running and motivating people for prevention.
Right. Sir, I heard that some people they even take snake bite to have the kick. They take snake venom in their body. So, who are these people, sir? Who are the abusers and who are the snake keepers? Who are the supplier? And this is not only a case of only substance abuse; they are abusing the snakes also. So, will you
I think
please tell
this
about
kind of
what is this
news
peculiar
is
addiction?
visible in the popular news media, but scientifically there is no evidence that snake venom contains any substance which can produce pleasure or addiction. So, most likely, these people who are claiming that they are
Oh,
using snake venom, they are hiding either a substance which they are using, or they are having a psychiatric issue, mental health issues, which is causing them to boast about snake venom abuse. So, no factual scientific information about snake
oh,
venom addiction. It is a way to hide some other
okay,
issue. Either they're taking cannabis, they are taking opiates, or
okay.
some other substance, or they are
Huh,
claiming to be faith healers, big faith
huh.
healers, or tantrics. They who claim such kind of things.
Right.
Or
Oh,
there was a news about lizards tail being
okay,
used as
okay.
addictive substance in prisons. Punjab. But then the factual
Oh, acha.
uh, inquiry into this revealed that it was not uh, results that they were consuming
Hmm.
uh, some other substance which was coming through the uh, smuggled into the prison, and they were hiding that particular intoxicant. Scientifically, there is nothing
Hmm,
about
hmm, hmm, hmm.
venom which can produce addiction.
Right, right. राइट राइट सो आपके पूरा ये जो 40 इयर्स के एक्सपीरियंस में ऐसा कोई ड्रगिया आपके पास नहीं
I
आया
have
जो बोला मेरे को
seen
स्नेक
two people
वेनम
who
लेना
have come
पड़ता है
in.
राइट
One was claiming that he was using this
हाँ
snake's skin, burn it and use it, inhale it. And there was one
इनहेल इट
who was
मतलब
using
क्या क्या दिमाग में
lizard
कैसे
tail,
आता है सर
crush it and drink it.
अच्छा
Was not proven. He was using cannabis,
ओ
in fact,
ओ
and a particular kind of addiction which
ओके
uh, I have not seen anywhere else, only in our part of the uh, country, is Iodex, the ointment which is used for
अच्छा
pain relief. People are using it
या
as making
पोटेन
a
या
sandwich, toast, and filled with the Iodex, and they eat it. Then there are people,
तो उसे पेट
we
नहीं
don't know,
सर
and
स्टोमक
they are
में कोई
very
इफेक्ट नहीं पेट
peculiar
खराब
kind
नहीं
of
हो
thing.
जाता
Then
उससे
we used the also, I have also seen
माय गॉड
prisoners getting their heads shaved off, then putting a lot of iodex on it and sitting in the sun. The fumes of the menthol which is there and the other substances, they give them a kick.
ओके
Yes.
दिस इज स्टिल बेटर Okay. Okay, sir. How does a parent who is a substance abuser affect the upbringing of his or her children in their growing years? And what are the effects expected in their children when they grow up? And at the same time, I would like to ask you, ki, is there, we can positive effect also, in the sense the children are watching their parents abusing substance, and they see the ill effects, witness the ill effects on the happiness and well-being of the family of this substance abuse. So maybe they will never indulge or encourage when they are adults in substance abuse. But again, we hear that when what children watch their parents to do, even if that their habits affect them in a bad negative way, but still somehow children behave like their parents only when they grow up, even if they do not appreciated their parents. So what is
That's
this
a
psychological,
good
this
question
connection,
people
and all?
might
Please explain,
be
sir.
interested in. Uh, we always say that prevention, when we talk about prevention,
Mm.
at the parental level, we say that parents should be models. They should not take drugs themselves. So, human behavior consists of nature and nurture. The genetics and the environment both are coming into play. So, if parents, one of the parent is taking any substance or is addicted to any substance, first thing is that his behavior will definitely
Mm.
cause stress to the children. There are more chances of domestic violence in these families, more chances of financial distress, more chances of breakup. So, because of this stress, the children, the offsprings are going to face problems and they may get into substance abuse. The chances that since the child has seen the family suffering because of father's drinking or mother's addiction, that he or she will not take to these drugs are much less. Because, yes, they are much
Oh,
more
much less.
vulnerable. Children who have
Oh,
seen their parents into substance abuse are more vulnerable to substance abuse disorder because of many other
that means children who are seeing their fathers not respecting women.
many
So
times.
they, those sons, they will also turn
It's a
to be
learned
like that.
behavior as well. Yes,
Oh,
yes.
that is so sad. Okay, right. Oh, okay, sir. Uh, Anyway, next question is, sir, you are an expert in adolescent psychiatry. So, my next question to you is a direct concern from one of my friends. She discovered that her son, from her son's iPad history, that the history is associated to some pornographic videos and pictures. Her son is only 10 years old. So, what should she do, sir? Now, because she cannot discuss it with others, she is not sure. She asked the son, "Have you seen something else like that?" Indirectly, the son refused. So now she has not done anything, in fact. So, but she is only checking the history. Now she could not find. Maybe the child became conscious. So, I'm
This is
asking
not
you, sir,
an
what
uncommon
ideally she
problem,
should do?
especially after COVID. Since in India, the availability of
Okay.
digital media is much more common than the availability of digital literacy. Safety of the digital media is less talked about, whereas the availability, free availability of data, free availability of the gadgets. Every school child has a mobile phone and he has a WhatsApp, he has a Instagram. And the because the homework is given on the phone. After COVID, everybody is using phone as a method to study. In the night,
Mm. And the
Yes.
WhatsApp groups are made between the parents, between the
And
groups
the
of
safety
students groups
of
for
the
projects.
digital media
Yes.
is less talked about. Parents, many of the parents don't even know that there is a digital lock, that you can search media, you can keep an eye on this search history, and so many things which are not taught to neither to the children nor to the parents. But availability is there. It's a very low cost availability. So everybody is using it and misusing it. So children in the WhatsApp groups or in the schools, they get used to seeing many of the things which they should not, which they are not learned about. And many times the parents also don't keep their phones locked, because they hand over to the child, and every child wants to watch Instagram and YouTube. And if the parents are using YouTube to watch some of the X films, shorts, or reels on the Instagram, these children, they automatically come into the scrolling, and they can watch. Many times it is in gallery. The
Yes.
child doesn't know what is coming out. And suddenly the parent finds out that he was watching a video which the father had saved. It's a pornographic video. And then there is a problem. So once a parent finds out that the child has seen a pornographic video, or he is seeing it regularly, first and foremost thing is conversation. Not scolding, not beating up, not insulting, but listening to the child, what is happening and what he knows about what he has watched.
But sir, how to bring the topic like child? How to like say, ki, are you watching
You
pornographic
have to,
video? Like
because
10 years old child,
seen in
sir.
the search history, you can gradually pick up what you
Yes.
like, which are the movies you like, what are the things
Yes.
you have
I
seen,
got.
and whether you have seen any of these, this kind of, you can gradually build up from romance to sex, friendship to romance to sex.
Yes.
And
Yes. Yes. I got
once
it.
you find out, the parents should have the sex education themselves, and they should talk to the
Yes.
child and ask him to put questions. If the child asks you, you should not snub them. ये कुछ नहीं है, तुम्हारे
Yes.
काम का नहीं है. You don't need this. This
Yes.
is for big. Once you grow up, you will know. He will not
Yes.
know once he grows up. If he wants to know, talk to him. And similarly, they say that sex education in schools, if it is properly given, age appropriate sex education, that can help in these cases. And most of the time,
Yes.
digital lock, keep a watch on the search history, and especially at night, once the child is using mobile, iPad, you have to be very careful. And keep a watch on the
Okay.
friend list.
Okay. Thank you so much, sir.
And if he is using Instagram, try to find out whom
Right.
he or she is following regular. So you have to be aware as a parent and
Right. Yes.
be friendly with the child. Don't hold him, don't beat him up, but listen to and talk properly.
Yes.
And if there is a
And talk.
regular
Yes. You
pattern
have to
of
face
such
this
behavior,
issue. Yes.
and you are not able to talk it out with the child, take help of a mental health professional.
Yes.
If it is a habit of the child and you are not able to tackle it,
Right.
there's no harm, there's no shame in contacting mental health professional. These days, even in schools, all
Yes.
CBSE schools have a counselor.
Yeah. Yes. Yes. All
So,
private schools are also having, sir. Mm.
yes.
Mm. Yeah. Thank you so much, sir. I will share this with my friend. Mm. Sir, is there is a term sex addict? Who is a sex
Yeah.
addict? Is there any such
From
thing?
substance
Any
use
such
or
disease or
addictions,
addiction?
people have moved on to behavioral addictions. And sex addiction is one of the behavioral addictions. It exists. And it can be not
So it
only
exists.
either normal
Okay.
sex addiction, that it can be increase in the sexual activity with one partner, it can be multiple partners, it can be sexual deviations in the sense that it can be just addiction to watching porn
Okay.
movies, it addiction to masturbation, it can be
Hmm. Hmm.
unnatural strategy
Any
and
unnatural sex
it
even.
may not be
Hmm.
in isolation.
Okay.
Many a times it is a manifestation of an underlying mental health problem. It many a times it can be a manifestation of bipolar disorder.
Oh.
It can be a part of the
Oh.
personality disorder, and sometimes it can also be a part of the effect of a drug that person is taking. That his sexual desire higher and higher, and he is not able to control. Many can. So this needs to be
Okay.
investigated,
So,
evaluated
uh,
properly, and then if there is a need, there is treatment possible.
but do they come, sir, to doctors? Like, do they come to you on their
Many
own,
a
like, I
time they
have this
hide, the
problem, or
partners
they
come,
hide?
seek help.
Ah.
Partners,
Because they are
sometimes
dangerous to the
partners
society
seek
also,
help.
na, this
Sometimes
behavior?
they have to go through the legal system.
Okay. Right. Okay. Sir, I'd like to ask you something. It is very sensitive also. Because we Indian parents normally have a habit of sharing their bedroom and bed with their children till they attain their adulthood. And sometimes it even continues after that. Whereas it is, especially in Western countries, it is considered as a gross violation. But Indian parents feel that it is rude or harsh to separate the children, uh, giving them separate bedrooms. And sometimes they cannot afford also to give a separate room for the children. So, this system, is it good? I would like to have your opinion. Is it good for the children to sleep,
Till a
share the
particular
same bed
age,
with the
it's
parents,
good that
with the parents?
children share the bedroom. But at the same
Hmm.
time, once the child grows, they I feel
Hmm.
that the parents should gradually make the child understand that
Hmm.
it's we love you
Hmm.
so much, but you need to grow up. You need to learn to be independent. With you, if you are sleeping separately, it is not that we don't love you.
Hmm.
So to start with, it may be that he goes to
Hmm.
sleep for a weekend, and then you see the days, and then make him. Then you can tell
Right.
that children who are going to boarding
Hmm.
school, or once you go to a professional
Hmm.
school, you have to sleep in a separate room by your own. So you need to learn these things, and there is no harm
Ah,
in if you are sleeping.
yes.
away from us. We are with you. Sometimes they make the arrangement such that there is a partition in the children bedroom, and they initially they can keep open the door, and then gradually, once they get used to sleeping separately, they can. It has to be a gradual process, and it has to be well controlled. Yes. And well talked about with the children. So, process.
Yes. Gradual and smooth process. Yeah. And sir, what effect a child can have on her mind if they're accidentally exposed to the intimacy of parents? Nobody talks about this, but I think many of the people have this kind of experience, depending on the extent.
Is an issue which is less talked about, experienced most of the times, but it is
Yes.
not discussed because of the taboo against sex.
Yeah. Yeah. But sir, definitely it is not desirable. I don't think
The
it is
impact
desirable.
can
Nobody
have on the
wants to
child
see that, right?
depends upon his
Huh.
age, at which age he has seen, and what was his state of mind at that time. If he was drowsy, he got up and he goes to sleep and he sees it's once, it may not have any impact on that. But if it is repeatedly done, and then he has to be told, he, it can go into his
He
memory.
remembers,
He
it
can
remains
be
in his memory.
angry against one of the parents. He may not think that it is a kind of sexual, because he may not have the total knowledge about it. He may think that they are fighting. He may think that they are playing. So, depending upon his age, if he is questioning, then the parents have to talk to the child, not just stop at the same time. They have to listen to him, and then if he has a query, you need to address that. And any time, any way, parents have to be careful and watchful when they are. Yes.
Yeah. Ideally, this should never happen, right, sir? Mm. Mm. Sir, children are the future of nation. And happy families make a happy community, and happy communities make a strong nation. Right. Sir, in this note, I would request you to give your message to my viewers how to create, how to maintain, and how to nurture happy families, because at least this is at what least we can do for our country as well as for ourselves. So, आपका क्या message है, sir? You have so much experience, 40 years of experience, depending on people's psychology, and we know it is head is the most important thing. मन में अगर आपके मन में है मैं दुनिया जय कर लूंगी तो हो ही जाता है. If you want to conquer the world, you can do it.
I think I would.
So it is
not
everything is in the mind.
About this as a professional, but I will talk about as a parent what I like and what I have really done. I will not
Yes.
talk about theory. I will talk about what practice I have followed, and I like that people can follow.
Yes.
One is giving unconditional love and affection to your children. Have a good listening attitude when they have a query, when they talk about anything. Listen to them and give clear communication. And spending quality time with your children. You may be busy throughout you have your career when the children are young. You have to spend a lot of time with your whatever job you're doing, but quality time with your children is very important. It is an investment which is going to grow with time. And I say that one meal a day at least family should have together. And your
Mhm.
phones should be away, your media should
Together.
be away, and you should be listening to and watching your child. That's another thing. Quality time, once you are free, you should spend time with your children, either going for a walk, going to a drive, or doing their helping
Mhm.
in their homework, whatever. But every day you have to do that. Spend quality time with
Yes.
your children,
Mm.
and
Yes.
they are
Yes.
growing. They are growing.
Yes.
They are growing.
And sir, I was just
You
thinking
should
like,
become
huh,
their
yes, sir.
friends rather than their boss. And you should keep an eye on
Mm.
their friends and see that they are in good company. That's my way
Mm.
of looking at my children. They should, it's not how much they marks they get in these exams, but how good as human being they grow and have the compassion, the empathy, and
Yes.
the honesty to discuss their issues whenever they have. That's so that they become good human beings, good citizens, good
Yes.
human
A
beings,
good
and
human
whatever
being. That
profession
is
they
the
are
most
in,
important
they
thing.
should excel in that, and they should be ethical.
Yes. Yes. Yes, sir. And sir, I was another point I would like to
Yes,
add
they should
here.
be models.
Parents should not abuse substance, right? And another thing, like we have a culture of celebrating any family occasion, like anniversary, birthday. We go
Yeah,
out to eat. That's a common culture, right? So I was thinking, like there should be, we should develop a culture of having a common
yes,
time
that's
together, playing some game, doing some
yes,
physical activity. No, that is also very much because physical activity too is going less and less amongst children also, and everybody needs physical activity. And if the family plays some game together, anything, badminton, table tennis, or walk, maybe a marathon sort of, or some run, anything. If it makes culture that we'll do that once in a month or on our special once in 2 months, all of
yeah,
us, so
that's good.
that
That's a
will
good idea.
increase the bonding, isn't it? Yeah.
Thank you.
Thank you so much, sir, for your priceless time for this podcast. And I came to know so many things, so many new things about substance abuse and other things also. Like
Thank you.
I cannot express in words how grateful I am to you. And I am requesting my viewers, please, please watch this podcast with Dr. Roop Siddhana with patience because you're watching this
Thank you.
podcast may
Let's
change
hope
a
for the best.
life for
Thank you.
better.
Okay.
Thank you. Yes,
Okay.
sir. Namaste. Jai Hind. Satyameva Jayate.